Hi, Jaden. It's nice to meet you.
Hi.
I'm Dr. Wilson, and I use she and her pronouns. Your privacy and confidentiality are very important to us. Everything we discuss today is strictly confidential. What brings you in? I saw in your notes that you have itching and body acne. Can you tell me more about that?
Well, it's actually a pimple down there and I've been itchy there too. I'm pretty active in skateboard with my friends, but I noticed that this popped up after a sweaty day in gym class last week. I did have sex like a week before that class, and everyone online and at my school keeps talking about an STI called blue waffle.
Wow! Talks of blue waffle were going around when I was a teen. It's interesting that misinformation is still spreading.
Really?
I understand how confusing it can be to tell what's real from what's fake, especially with so much online. I'm glad you mentioned it because now we can talk and clear up any confusion. I can assure you that blue waffle isn't a real STI.
What a relief.
Can you share the websites or information you've seen about blue waffle?
Sure.
Let's talk more so we can address your concerns about body acne, which is normal for any active teen.
It's important for providers to build trust and respect with their patients. You can do this by keeping communication open and using language that is easy for young people to understand.
That's wild that made-up stuff about blue waffle is still going around then. Thank you for listening to me and not writing me off for falling for that. I'm just nervous about STIs. Can you share some resources I can trust and can get more info about STIs from?
Of course! I saw that one of the links was a great debunking post from Planned Parenthood, and the other wasn't from a credible source. But you did your research and reached out to a professional, which is great. I'll share some resources in the chat.
It's hard for young people to know if health information online is true, especially from friends or influencers. Support them by sharing links to sex education sites like Planned Parenthood and You Choose Baltimore, and social media educators like Amaze for quick, credible information. Encourage them to also turn to a trusted adult or a medical professional to help answer their questions.
As for your body acne, I think that will go away if you shower right after working out and avoid tight clothing to let your skin breathe. We can look into getting you an STI screening, or we can mail you an at-home testing kit.
Wow, that sounds good. Thank you for the tips and resources. I'll do the at-home testing, please. Where can I sign up?
I'll share the link for the at-home STI testing in your appointment notes. If you need anything else, please don't hesitate to ask. We'll be in touch after we get your STI results in, but try not to worry about it in the meantime. STIs are very treatable and common.
Thanks, doctor. Bye.
Bye!
We know that you care about your patients, and as we heard with Jaden and Dr. Wilson, active listening goes a long way in getting a patient to open up about a concern that they have. Active listening may look like keeping an open mind about questions from the internet that young people may bring to an appointment.